Welcome to the patient assessment scenario. In this training, you'll encounter a patient experiencing an unknown medical issue. Your task is to use your skills in assessment and critical thinking to determine the best course of action. As a first responder, every call presents a unique set of challenges, so take your time, gather information, and remember, your ability to assess accurately could make all the difference. If the timer is too fast initially, don't be afraid to pause the video to give yourself more time to think. For the best improvements, pausing and writing down your answer will always be the best way to learn. Fire Dispatch to Medic 70, you are dispatched to a sick call of a male patient at work currently in his office. The patient advises he is feeling weak and would like to be further assessed. You arrive on scene outside of a dark building. The time is currently 7 p.m. and the patient is inside of an office. What two things do you need to consider as you approach the entrance? Two things that you need to consider are BSI or body substance isolation and scene safety. So, you put on your gloves before you exit the ambulance while inspecting the outside, noting that you don't see anything suspicious as you move forward. You are greeted by the office's manager who leads you to the patient sitting down in his office. The patient is approximately 30 years old and is sitting down looking at you as you walk in. The patient appears sluggish. When turning his head towards you, just off of this initial assessment, what are some differential diagnoses that we can consider? Even though we haven't gathered much information, some initial differential diagnoses we can consider are the patient can potentially be experiencing a stroke, they can be recovering from a seizure, they could potentially have an opioid overdose, they could either be hypoglycemic or hyperglycemic, and there's a couple other options that we aren't going to talk about today. However, these are things that we should initially be considering. So now our goal is to chip away at some of our differential diagnosis. So, to rule out a stroke, we can consider performing a VAN assessment, a Cincinnati stroke assessment, which I generally like to mix the two. You can also consider doing a fast stroke assessment. I'd highly recommend to gather some more information on your own time, and on another video I'll go more into detail about a stroke assessment. Before we do that though, we should also consider establishing the patient's current mental status, checking if they are ANO times 4, along with checking their GCS score, which will give us more clues on the patient's current medical condition. So, what are 4 questions that we can ask the patient to assess if they are ANO times 4? To assess if the patient is ANO times 4, we can ask him, what is his name? Where is the patient currently at? What time is it currently? What happened that made someone call 911? More so, this is asking the patient his person, place, time, and event. Whichever order you decide to learn it as, I would highly recommend assessing it the same way every time, going in the same order. So if you choose person, place, time, and event, do it that same way every time so you don't miss anything. Also, understand that if you're working with an elderly patient, they may struggle slightly with the time aspect, so you might have to do some slight adjustments in a real-world scenario. So, you ask the patient the ANO times 4 questions, and he responds with, his name is Jeff. He doesn't know where he's at right now. He says that it is 7 p.m. and he doesn't know what's going on and what's currently happening. With the confirmation of his name from the manager, we can assume that this patient is currently ANO times 2, so he does have an altered mental status currently. When an event like this occurs, it's important to use resources such as coworkers or family members that are also potentially on scene. For this instance, we asked the manager, and he advises that he's never seen Jeff acting like this before. So, Besides a Van and Cincinnati stroke assessment, what is the next step in treating this patient? We need to gather vital signs. So, we assess the patient's vitals and their current blood pressure is 124/72. Their heart rate is at 88. They're satting at 94%. Their respiratory rate is at 16. Their temperature is at 98.4 degrees Fahrenheit, and their blood sugar is at 56. Which vitals stick out to you? The vital that should stick out to you is that their blood sugar is currently at 56. That is within the low range. If you have watched my vital signs video, I talk about the reference ranges being between 70 and 120. So, the patient is currently presenting as being hypoglycemic. Now, the manager was able to contact the patient's wife. While on the phone, you're able to utilize the sample mnemonic, which stands for signs and symptoms, allergies, medications, past medical history, last oral intake, and events. You gather from the manager, the patient's wife on the phone, and your own personal assessment that the patient's blood sugar is currently low. The patient is presenting currently with hypoglycemia. The patient has no known drug allergies. The patient takes lisinopril, hydrochlorothiazide, and metformin. The patient's past medical history was unknown by the wife, but you can tell because the patient is taking lisinopril and hydrochlorothiazide that the patient has a past history of hypertension. And from the metformin, you can tell that the patient has a past history of being diabetic. The last oral intake was at 10 p.m. yesterday. The patient just recently became diabetic and is trying to go on a fast while starting his medication. This is especially dangerous for new diabetics, since diabetic medications are usually titrated to treat somebody who is eating a breakfast, lunch, and dinner at appropriate times. The event was the patient's manager came into the patient's office 20 minutes ago and noticed that the patient wasn't making any sense when he talked. What are some medications that we can consider administering to this patient? What medications do we have to avoid here? We cannot administer oral glucose to this patient because they are A/NO times 2. Because of this altered mental status, we must avoid administering anything orally via the mouth because we don't want him to aspirate on the medication. If you are an EMT basic, this is where the correct answer choice would be to request ALS Intercept. For paramedics, though, we would consider starting an IV or an IO and administer dextrose either 10% or 50%, depending on your local protocols or SOGs. If we cannot obtain a line, we can consider administering glucagon intramuscularly. However, I've personally seen mixed results in the past, so a prompt transport with administration of this medication is generally recommended. With administration of dextrose from an ALS provider, and in this instance, we'll say that it's from a paramedic, the patient has started to present normally after around 5 minutes. The patient is able to answer all 4 A/NO times 4 questions. Do you remember what those 4 questions are? The 4 different questions you need to ask are person, place, time, and event. You reassess your patient's vital signs, but if these were his previous vital signs, what do you expect to change? More specifically, what do you expect to go up and down? The patient's new vital signs are as follows. The blood pressure is 124/72. The heart rate is at 88. They're satting at 94%. Their respiratory rate is at 16. Their temperature is at 98.4 degrees Fahrenheit. And their blood sugar is at 218. If you recall from a previous video where I go over vital signs, this patient has gone from less than 70 blood sugar to greater than 120 blood sugar, with 70 to 120 being our general reference range. However, high blood sugar is bad, low blood sugar is deadly. We would expect a patient's blood sugar to increase fairly high after administration of dextrose. Personally, once it hits around the 300 mark, or more so 350, that's when I start to become fairly concerned. But please follow your local protocols and SOGs regarding hyperglycemia. The patient refuses transport, saying that he needs to be more careful with his diet. And as a provider, you advise him that he should eat something substantial like a sandwich or a taco. Maybe have his wife come and pick him up for today, depending on his current strength. This would be a good time to go over the importance of eating breakfast, lunch, and dinner while taking diabetic medications, and explaining more about how his body is adjusting, and to talk to his PCP about this current event. Thank you all for watching this video. If you did like this, please like and comment. It shows me that people want to see more of this content, and I'll keep working on it. But anyway, I'll see you guys on the next one. See ya.